You understand that you use Alcohol Action Ireland launched your manifesto for the general election last week. Can you tell me what you were calling for?
Well, we launched it last week, obviously with the election campaign underway, and essentially what we're trying to do is to highlight, I suppose, first and foremost, the fact that for over the last decade, whilst there's been a lot of effort around trying to bring about legislative change and new frameworks around controls, that in essence we still are continuing to drink at a high level in Ireland, or over the last decade we really haven't changed the dial in relation to the level of consumption. Now, thankfully, it hasn't significantly risen, but it has maintained a level of status that we find disturbing. And so what we've highlighted again in our election manifesto is a 5-point plan that we think is kind of necessary to renew Ireland's public health approach to alcohol. And if you forbear with me, I can give you the 5 points essentially. Yeah. So I think that the main issue that we're seeking to try and ensure that the new government would and the new Oireachtas would focus on is a coherent and immediate implementation of the Public Health Act, Public Health Alcohol Act, and essentially that's because largely some of the best endeavours of that act have not been commenced, and we really would like to see those pushed through and made operable very quickly. The second thing we'd like to see is a new initiative around having a state-sponsored office. So people might be familiar with the endeavour that we've taken around tobacco, and a lot of those initiatives that are around tobacco and reducing tobacco consumption or smoking is driven by a dedicated office within the Department of Health which focuses on those matters, and we feel that there's an opportunity to do that around alcohol policy. So that would have a power and a role that could drive this momentum. The third thing is we think that the new government should strive, as we've always indicated in our earlier work, the need for the fact that a child should be entitled to a childhood free from alcohol harm. And there's a whole variety of related matters to that, especially those driven by our own initiative around silent voices and the need for treatment services and interventions that are important to assist children who are experiencing harm, not just in everyday life, but also within the context of parental alcohol misuse. We've also asked for a renewed focus on the services around alcohol harm itself and alcohol treatment services, which we think are chronically underfunded. And finally, we've asked for a review of the existing low-risk drinking guidelines, which at this stage are now nearly 12 years old and haven't been reviewed for some time, and a lot of new and interesting research has taken place, both in Europe and across internationally, on the levels of what are now regarded as a low risk approach to alcohol. I think that that research and that insight needs to be reflected in a new review of our drinking guidelines. So they're the 5 points that we're trying to ensure that a new Oireachtas, which will be elected on February the 8th, and then subsequently a government out of that would try to take on board.
I've done loads of interviews with you over the last few years on the Public Health Alcohol Act, so maybe we don't have to go into it in depth again today. Just a couple of questions on your 5 policies there. The issue of alcohol services for people who have drinking problems or their families, like you said, is chronically underfunded. That's really a huge issue because, even in the public health system, there are hardly any services apart from Alcoholics Anonymous. Isn't that true? Isn't it?
It is quite true. We know that by looking at the data that in any one given year there should be approximately somewhere between 15 and 20,000 people presenting for treatment. But we know from the data from the HRB, from the Health Research Board, in Ireland last year only 3,500 new cases were treated. So there's a huge gap that's between what we know is seeking assistance and those who are actually receiving assistance. And I think it indicates quite clearly that there's a chronic shortage of alcohol treatment, especially, as you say, within the public system. And what we've identified in that context is the need to develop, it had existed in the past, certainly before recessionary times, earlier in the early part of the century, is the development of what are called alcohol care teams, essentially, which would be placed within the acute hospital system, which essentially would bring about a multidisciplinary team to, bring about alcohol treatment pathways for people, both at a primary level but also throughout the secondary system and tertiary systems of the health system. So we think that that's a significant problem. More, within the tier of this, there's a whole race of people who we would see have been impacted by alcohol harm to others, and we typically talk about those 200,000 children that are living in families today who are impacted by alcohol. But there's also the 400,000 people who, as adults, have to deal with a day-to-day trauma of how their lives have been impacted by alcohol in their families as they grew up. And so there's a whole need to look at a whole related set of services that are appropriate for those who've had adverse childhood experiences just today and in the past. And I think that trauma-informed support services are chronically absent in the system as well. So these are real tangible things that absolutely need to be done. But unfortunately, I think what we've seen over the drift of the recessionary period and into today is essentially a sort of a casual view of it that says simply you have to be responsible for yourself, and we find that unacceptable. And we think that this is a scar that runs through many communities in Ireland, and we think that there is an absolute need for us to really put in place some meaningful services for people, which we've costed before in our budget submissions. And you're not talking about a huge amount of money here. You really are talking in low millions that could make a significant difference across the system.
One big difference between, I believe, the public health system and the private health system is in the public health system they have care teams, like they have a psychologist, psychiatrist, nurse, social worker. But usually I've heard, I don't know if this is true now, but usually I've heard they haven't actually got an addiction psychiatrist or psychologist or whatever the term is on the team. Is that true, yeah?
Well, I think first of all, what you'd have to say is that those teams really, whilst they may exist in pockets, they are not a universal available service, and that is in itself the problem. So what we're seeking to do, and we've spoken to a number of service providers, both in Galway and in Beaumont, here in Dublin, which is close to yourselves there. With this need for developing a design package around alcohol care teams that would have that multidisciplinary approach is what's required, and then ensure that they're placed within all of the acute hospitals, of which there are around 32 or so. And I think that's what's required in this case. So what we have at the moment is we have small pockets, throughout the country that have hung in there over the period of time of recession, but largely all the others have largely disappeared, and there's no real momentum to try and replace those. So what we're trying to say is, let's get back to this idea of having these alcohol care teams that take a multidisciplinary approach and can provide all the services that are required to try and tackle what is, sadly, a great difficulty for many families in Ireland. And we think, individually, that there's likely to be somewhere between 15 and 20,000 people seeking that help on an annual basis.
And they wouldn't actually be called alcohol care teams, would they?
Well, we're calling them alcohol care teams, but they may very well be. I think a name is relatively easily to accommodate. When people have a better name for them, good and well, but that's what we're calling them, and that's what they're within the UK system. That's certainly what they're called as well.
Okay, and how's your Silent Voices campaign going?
Well, that Silent Voices campaign has been very interesting. We're just coming up to the first anniversary of that campaign, and we think that we've done quite a significant amount of work in raising the awareness of the adverse childhood experiences that people have had to encounter. And I think in the whole over the year, I think we've had a couple of very interesting seminars. We've had a very interesting engagement from the media. Politically, there's been a little bit of interest in it, not a huge amount, but I think that overall, given the limited resources we have, which as you probably appreciate are extremely limited, we think we've done pretty well to raise a very difficult subject for a lot of people.
And you're on Twitter, aren't you? That campaign?
We're on all social media channels, absolutely, and we Instagram is quite a popular for source of that. And we're very grateful for the number of people. We do have a dedicated web page on our website, and we offer a platform for people to share their experiences, and that's a key part of what we're trying to do here, is to ensure that people understand that they're not alone, and that there are other people who have come through the other side of these experiences. And thankfully, a number of people, certainly over 20 people, have made contributions to the website, and people can read those contributions. And again, I think sharing that experience and understand that they're not alone in trying to deal with some of the real traumas that people have to live with on a day-to-day basis.
Okay, we've talked more in depth there about 2 or 3 of your policy, your 5-point policies. Is there anything else you want to expand on as regards your other policies?
Well, I think the key thing, one of the major, we have spoken about it at length in the past, but the Public Health Alcohol Act, is a very, very important piece of legislation. It does establish a number of controls and regulations around the demand and supply of alcohol, but it is only useful and will only bring about the real target and real objective, which is to lower alcohol consumption. It'll only do that if it is really implemented, and I think that in the context of that, key initiatives like minimum unit pricing, like the content of advertising, like the broadcast watershed, and accurate labelling on alcohol products. Those 4 big ventures still haven't been commenced, and they're not legal in this country. And I think that if you get a knock on the door tonight from an aspiring politician, I would say to you, please ask them, where is the Public Health Alcohol Act? Why hasn't it been implemented? And what will you do about it when you get into power? And I think that, were that to be fully, coherently and comprehensively implemented and made operable, we would see in a very short period significant improvements in some of the dreadful outcomes that we already are experiencing because of alcohol-related harm.